Can I share which of the WhatsApp name is our speaker? Is that Abdulaziz or Tuwobala? Which one is the speaker's WhatsApp? I can see Abdulaziz, I can see Tuwobala.
It's Abdulaziz, inshallah.
Okay, good.
Assalamu alaikum warahmatullahi wabarakatuh.
Walaikum salam wa rahmatullah. I think we'll make a start now, inshallah. نعم أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه وسلم تسليما كثيرا. We give thanks to Allah subhanahu wa ta'ala with despite his oneness. We ask him to send his salah and salutations to the noble soul Prophet Muhammad sallallahu alayhi wa sallam. And we start today's session with in the name of Allah. We ask Allah subhanahu wa ta'ala to bless the session for us and make it beneficial for everyone. Alhamdulillah, we are thrilled to have with us Dr. Abdulaziz Towobola, who will be discussing an important topic, which is not the usual one that we'll discuss. But like we've promised, every now and then we'll be bringing topics that are very mundane and very relevant to what we do on a daily basis. And I'm sure you would all agree with me that the topic we have today is a relevant one, especially in this climate where there's a lot of stressors. There's a lot of financial instability, so which naturally would bring about what we call stress, anxiety. So the talk today is going to be about how do we cope with the stress, the anxiety, what are the causes of them, how can we cope with them, how can we prevent them if possible? Can we actually prevent them? So these are some of those aspects that we'll explore today. And we have a psychiatrist in our midst, inshallah, to discuss this topic. There will be ample time at the end where we can ask questions and we can take contributions, inshallah. So I would implore everyone to get their pen and papers, note down your questions. So at the end, so you can ask either directly or through the chat area. So we have Dr. Abdulaziz Toobala with us. Without much ado, I will hand over the invisible mic to him. Yeah, Doctor, please start.
Jazakallah khair.
You should be able to share your screen now, inshallah.
Okay. Jazakallah khair, Dr. Abdul Majid. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله وحده والصلاة والسلام على من لا نبي بعده. I thank Allah subhanahu wa ta'ala for providing this opportunity for me to be with you today to lead the discussion of this important topic, coping with stress and anxiety. I also thank Brother Abdul Majid and the organizers of this program from the Muslim Family of Britain, Muslim Forum of Britain. May Almighty Allah continue to bless all the members and accept your efforts and continue to make the organization flourish. So I will share my screen now. Are you able to see this?
Still coming up, I guess. Not yet.
Not yet. No, it's not done yet. Okay.
Yes, we can see now.
Alhamdulillah. Okay. Good. Alhamdulillah. So inshallah, let's start. So coping with anxiety and stress. I'm sure we are all aware this is a very common, experience, perhaps common to every one of us. Or is there anyone here who hasn't experienced anxiety and stress before? Maybe perhaps they can raise up their hands and comment about it. I would really like to know your secrets if you haven't experienced anxiety and stress before. Anyone? Okay, perhaps not. So anxiety is perhaps the most common symptom, mental symptom, because it virtually presents in almost every other mental disorder and perhaps some physical health problems as well. In terms of anxiety disorder, it is quite common. In a survey done recently in 2022 in the UK, it was found that 37% of women and 30% of men reported that they had high levels of anxiety. Um, the World Health Organization says that about 301 million people suffer from anxiety disorders globally. However, just only one out of four um, receive treatment. Yet anxiety disorders or stress-related disorders are very treatable as people do respond to treatment. But if people don't get the treatment they want, can lead to significant loss of functioning, such that it affects people's day-to-day activities in terms of their personal, family, social life, occupation, and education. It can also lead to suicide, as we will talk about this later on, and other mental health and physical health conditions as well. So it's really important to address this. And apart from that, um, apart from leading to sickness absences and affecting the nation's economy, for us as Muslims, um, people who do suffer from anxiety and stress or significant anxiety and stress, it can affect our ibadah, and, and we will not be able to perform it the way we want. So in this verse in Surah Al-Baqarah, Allah subhanahu wa ta'ala gives us heads up about what we are talking about today. So this is a reality check for us all, really. But at, at the end of the verse, it gives us the good news that for those who patiently endure these stressors or adversity and fear, then they're going to get a good reward. So, inshallah, today the learning objectives include increasing in our awareness of the burden of anxiety and stress. This is not just for our own sake. It's important for us to be able to recognize this in other people, so we'll be able to support them to get help. And if you find out we are the cause of the stress or anxiety for other people, then it's important really to be aware. And inshallah, we should be able to make some changes. And it's also important to understand the risk factors. So just like Dr. Abdul Majid said in the beginning, we will be better able to prevent it. As they say, prevention is better than cure. Or if it's happening already, we will be able to get help so that we get prompt diagnosis and treatment for this, so that it reduces the impact. And lastly, I would say it's vital for us to appreciate the Quran and Sunnah as invaluable resources for healing and recovery, because we are all Muslims on this platform, I believe. And this is the focus of what's known as personalized treatment, where it's advisable to target interventions to the individual based on the individual characteristics, as this seem to improve outcomes. So, what is anxiety and what is stress? Are they the same or are they different? Can they be used interchangeably? What do people think?
Feel free to unmute yourself, sign in the chat area. I'll read it out, inshallah. Those on YouTube as well can do that.
Yeah. I think the difficulty is I'm not able to see you once I go into this presentation mode.
I
Okay.
can't see any response yet. No.
Okay. Yeah. I think you will be my eye there, but have to magic. Okay. I'll just continue. So then we can have a fuller discussion at the end, inshallah. So anxiety is defined as an uncomfortable feeling of nervousness or worry about something that is happening or that might happen in the future. So anxiety is a normal response to danger, but it becomes abnormal when its severity is out of proportion to the threat of danger, or when it outlasts the threat. So stress, on the other hand, is great worry caused by a difficult situation or something that causes this condition. So certainly the two concepts are linked, they are interrelated. But for stress, you do need something that causes it. You need that difficult situation, which we will call the stressor or the stressful situation. Okay. And your response to that, which is sometimes also called stress, for clarification, we will call that your emotional response to stress. Okay. So for anxiety, it doesn't require any stressor or situation to cause it. People can just begin to worry and continue to worry, and it's often internal, really. So anxiety, in terms of stress, so the response to stress can either be predominantly an anxiety response. This tends to occur in events, threat-related events, for instance, illnesses, accidents, or it could be a predominantly depressive response, where the patient, rather than becoming anxious and restless and agitated, for the depressive response, they will be just down and sad, socially withdrawn. And this tends to occur more in separation or loss events. Maybe somebody very close to you or close to them died. So generally, stressful events provoke emotional reactions that are distressing, but not to the nature or severity required for the diagnosis of an anxiety or mood disorder. So, so why do we have stress? What is the function of stress and anxiety? So I'm sure we have all heard about the fight, flight, and freeze response. So these are the ways our body would respond to danger. So either we stay and confront and fight it, or we run away from it, that's the flight response, or we just freeze and become immobile and unable to do anything. So these are the ways our body responds to danger. But we find that from research, if you look at the graph in front of you, um, performance increases with stress or anxiety up to a certain level. So you can see the peak of the graph. Beyond that, there's a decline. If stress or anxiety continues, then leads to distress. So the person becomes fatigued and tired and exhausted. And if it continues, then we have breakdown and burnout. So may Allah protect us from that. So the DSM-5 and ICD-11, they are generally the classification system. DSM-5, that's the American system, ICD-11, the European system of classification. So there's been changes to this because previously anxiety and stress disorders were combined under one category before. But now, based on their research, they've found that research suggested that they are actually different. So they've separated them. So you do have different types of anxiety. I'll go back there. Different types of anxiety disorder, like in generalized anxiety disorder, the patient worries. There's something called free-floating anxiety. Just keeps on worrying about everything, really. Different about their health, their family members' health, about money, finances, relationship, their work, so about children. So everything, you tend to worry, just general worry about almost everything. But in panic disorder, this is characterized by panic attacks. Okay, so panic attack is a sudden episode of severe anxiety that it's so severe that the person believes or feels that they're going to die. So, and when it's recurrent, then you have what's known as panic disorder. And it can be associated with what's called agoraphobia. So that's the third on the list. And this is a situation where the individual um, has excessive fear or anxiety about going to places where they believe there will be it will be difficult to exit if there was a problem. For instance, they try to avoid shops or going to public places, even taking public transport. So because they fear perhaps something's going to happen to them and they're going to be embarrassed or they develop an anxiety attack and nobody will be able to help them. So I'm sure many people know about specific phobias, severe and excessive fear or irrational fear of maybe heights, of blood, of animals, or even spiders. So, social anxiety disorder that occurs where the individual has excessive fear and anxiety coming into places, into social spaces where they fear they're going to be scrutinized. Maybe it could be fear of public speaking or even eating outside where people can see them. And social anxiety, separation anxiety disorder that occurs a lot in children. It can happen in adults as well. Particularly, there's excessive worry about being separated from a loved one. And in terms of selective mutism, that occurs mostly in children as well. So they may be able to speak at home, but when they get to school, they are not able to speak. So they are unable to, they become mute in selected areas. So this is due to anxiety. And then the other categories at the bottom of the screen include when people take substances like drugs or medication. So, and hypochondriasis is also known as health anxiety disorder. So there's specific worry about people's health. So in terms of stress disorder, we have post-traumatic stress disorder, commonly known as PTSD. So you can see on your right-hand side, the stressors, because one of the important conditions to have stress disorders, you must have those stressors. So you can have either normal range of life experiences like divorce, bereavement, illness, or disability, socioeconomic problems, conflicts at home or at work, or extremely threatening or horrific stressors like natural disasters. So we recently, a few years ago, there was COVID, a pandemic. There could be earthquakes, a fire, flood. Then man-made disasters like war, serious accidents, and sexual violence and assault. For post-traumatic stress disorder, you need an extremely threatening or horrific stressor for that happens. And the individual experience continue to relieve the situation as if the trauma is happening to them again. And this happens in terms of nightmares, um, flashbacks, or intense, vivid images that keeps coming back to remind them of the situation. Then they try to avoid situation and things that would remind them of the trauma, and they also become really heightened they're so hyper vigilant that it's as if the threat is facing them again. So become hyper vigilant and they have enhanced startle response. So if an unexpected noise, maybe even a knock on the door, so they jump. So that's what we tend to see there. Um, for complex post-traumatic stress disorder, this usually occurs when you're exposed to multiple um, extremely threatening or horrific stressors. Or you should also have all those things I talked about, all those conditions of post-traumatic stress disorder. But in addition to that, the individuals experiences problems, significant problems with their mood regulation. So 1 minute they're feeling good, the next minute they struggle with their mood, maybe they're very sad. And they also have significant difficulties with their identity and self-image, personal identity, and also and the final condition for this is that they uh, um, they struggle with their interpersonal relationships with people, so significant problems in interpersonal relationships. And prolonged grief disorder occurs, of course, when grief goes beyond 6 months, and the person continues to experience behave as if they lost the person they lost, maybe their parents or children or partner just died recently. Adjustment disorder, usually the stresses are within the normal range of experiences like divorce, bereavement, illness, disability, and socioeconomic problems or conflict. But then the individual is not able to cope. They're not able to cope with the problem. So they are so preoccupied with every time you talk to them, it's the only thing they focus about and talk about will be the stressor. Um, Then reactive attachment disorder and disseminated social engagement disorders occur in children, particularly children who have faced severe neglect and maltreatment. Yeah. So acute stress reaction is actually a normal response to extremely threatening or horrific stressors. But it's a normal response because it's expected that when somebody faces that level of threat, but then there's an improvement. People begin to see improvement and resolution, which starts within a week of that of the stressor happening. So what I want us to get from this slide is that to be aware that all these symptoms that we see in stress or anxiety, there's evidence to show that um, they are linked to the central nervous system as well as the peripheral nervous system. So there are certain areas in the brain which, particularly imaging studies, have shown that they are either hyperactive or they have abnormal activation when people are stressed or anxious. And the good thing about it is that this activation, abnormal activation, respond to treatment. Um, and this has been shown. This have been shown in imaging. And so when we talk about, and of course, um, our body is connected. Our nerves connect to every part of our body, really, as you see in the diagram. So when we talk about all these anxiety symptoms, we shouldn't really be surprised. So in terms of psychological symptoms, there's that feeling of dread and apprehension. So people who are anxious begin to worry that something bad is going to happen. They may not know what, but they're just thinking something bad is going to happen. They feel restless, poor concentration, have narrowing of focus on danger. They're just worrying about the threat and the danger. Of course, we talked about worrying thoughts, then increased alertness, which leads to poor sleep and night terrors. and irritability, and just feeling bad and grumpy. And of course, that has an impact on people who are with them. And there's also what's known as derealization, where people feel that their environment feels unreal, or depersonalization, that they themselves they feel they are not real. So then you have these somatic symptoms. These are the bodily symptoms in terms of muscle tension. So people may begin to have headaches or muscle aches. And if this continues without distress, anxiety abating, it leads to tremor. So the person begins to shake. And then you have increased respiration or breathlessness. And if this continues, then the person will hyperventilate and becomes dizzy and have tingling sensation in the extremities. We also have autonomic symptoms like palpitation, um, your heart beating very fast, your heart skipping beats or missed beats. There's chest discomfort, sometimes chest pain. A lot of the time, you have people who are anxious, they believe they have heart problems, so they call the ambulance. And then, but investigation shows, well, no, this is just anxiety. So you have increased sweating, dry mouth, epigastric discomfort, flatulence, frequent loose stools, and difficulty in swallowing at times. Then the urge to urinate or defecate. Sometimes when the stressor is so great, the emotional response may be the person will become incontinent. So this can happen as well. So in failure to have an erection, amenorrhea, that's loss of your period, so for women, or menstrual discomfort. So of course, for a lot of the anxiety disorders we talked about, and even stress related disorders, there's avoidance of dangers or things that would remind you of the danger. So I think it's also important to be aware of what's known as stress hormones, particularly cortisol. Um, they in terms of their function, they help to prepare you, like I said before, for the fight or flight response. So, for instance, cortisol increases your blood sugar, um, improve memory and attention up to an extent, and blood pressure. So you have the energy to do the runaway or to fight. But then, if it persists, if stress persists, then it suppresses your immune system. And the immune system is responsible for fighting uh, um, diseases or bacteria and other microbes. So it suppresses that. You can see why people can become unwell when when they have prolonged stress. So it also reduces serotonin. Serotonin is one of the neurotransmitters that help in terms of your mood. So leads to sadness and also decrease sensitive to pain. So you can see that when after the stress, then people start complaining of or experiencing the body ache. But whilst the lion is chasing them or something, for instance, they have the energy, but afterwards, that's when they begin to feel the pain. And cortisol is also going to be linked to your circadian rhythm, so your sleep pattern. So in stress, that can your sleep pattern can be affected. So um, coping strategies are part of the responses that people develop in stress. So coping strategies are essentially um, those responses that people are aware of, and they tend to reduce the impact of stress. So that's why people have good coping strategies. So something will happen to them and you wouldn't see the effect of the stress. But for other people who don't have good coping strategies, then the stress will bring them down. So you can see the why people, let's say, a tsunami happened to everybody in the village. Some are affected more than the other people. So that could be one of the reasons. So I believe you can see that on your the list on your left-hand side. On your right-hand side, you have what's known as the defense mechanisms. So these are responses which are largely people are unaware of when they're faced with stress. So, for instance, in repression, the individual will forget, for instance, somebody who has been abused, who faced abuse in childhood, they will forget the memories of the abuse. So this is a way of trying to protect themselves and reduce the anxiety and the stress, the impact of the stress on them. But you can see that this can go on to have negative effects when you don't remember important aspects of your life. Sometimes denial can also happen. For instance, somebody was being diagnosed to have cancer, but then they continue to maybe they smoke or they drink. They have liver cirrhosis, but they continue to behave as if they don't have the condition. Displacement is another interesting one. This is where the individual sort of misplaces the response. An example is if an individual had a difficult day at work and due to a conflict with their boss or some sort of agreement with the boss, instead of responding or showing that response to the boss, they don't they displace that onto their children and maybe partner when they get home. So we'll just move on. Maybe if you have questions, we can discuss the other ones later. So in terms of causes and etiology, so it's often an interaction between genetics and the environment. So because there's evidence to show that people who are anxious, their offsprings have an increased risk of developing anxiety. For instance, panic disorder has an irritability of up to 40%, really. So even social anxiety disorder, and you can see that a lot of the anxiety disorder they start in childhood or in adolescence or early adulthood. So if you see anxiety disorder starting for the first time in later adult life or the elderly, then very likely there has to be another cause for it. So, and you can see on our right-hand side the triggers of panic. So in terms of environmental factors, so I'm not sure we have, Brother Abdul Majid, how much time do we have? Do we have opportunity to have a look at this YouTube video, which gives its...
Yeah, it depends on how long. Yeah, if it's not too long, why not?
Maybe we can watch for 2 or 3 minutes.
That's fine. Yeah, we still have about 20 minutes, inshallah.
20 minutes, inshallah. Okay. So it gives a good account of the interaction between
We can't hear anything if we started playing.
You can't. Oh, sorry.
So perhaps maybe you play it on your, then you probably share that screen instead of this one. I don't know. Or is it embedded within your presentation?
Okay, I'll
If you play separately on your laptop, then share the screen for that one, I guess. If any of the technical crew are here, if there's any support, they can support us, that would be great.
So, yeah.
A bunch of doctors, you see.
Share with your audio while sharing the screen. Tick your audio while sharing your screen.
Okay, take the audio.
Is it playing on your side, then, Dr. Blazis?
It is playing. Yeah, it was playing on my side.
We share your screen. We share the screen with the audio checked.
Okay,
So
I'll try
basically,
that.
instead of showing us what you're showing us now, share the screen for that particular one. So unshare this one and then share the screen for the video.
All right. Okay. Can you hear anything?
Nope. Or you send me the link. Send me the link to the on the chat area. Maybe I can share it on my side.
Okay.
Maybe.
All right. Let's send
If
it.
it's in the chat area there.
Oh, I think yeah.
Yes, we can see it now.
I'll start from the beginning.
We can't hear though.
Can you hear now?
We can't. We can see it, but not yet. We can't hear anything.
You can't hear?
No.
No. Audio.
Technical queue and
I
support.
think you just need, Brother Abdulaziz, you just need to unmute your own.
I think you need to unmute your own mic. You can hear from there.
Can you share the link?
Okay, I'll share. Let me share it.
I'll make you host, Brother then.
And how did you become that person?
Is it
We can
better
hear
now?
now.
Could it be that the answer to both of these questions is
It's
actually
fine.
the same? Before you were born, the world around you was already having an effect. Your mother and father, their genes, health, culture, and life history, if they were fit or ill, if they had good nutrition or didn't have access to it. Even how they felt about the stresses in their lives, including your arrival, will have had an influence. Then there's the style in which you were looked after, played with, fed and clothed. If you felt cared for or left alone, whether or not you felt safe in your childhood home, you were changed by it. Your experience has shaped and been shaped by your emotional development. Perhaps the attention you were given made it easy for you to attach and bond with the people that are important to you, or maybe it made it difficult to trust anyone and difficult for you to express what you need. Your individual response to life depends on what you have, who is around you, the stability of your relationships and your wider circumstances. It depends on your education, the jobs you got or weren't able to get. Did your experiences build into a picture of a world in which you can make meaningful changes, or one in which you feel powerless? In short, an unsatisfactory world, or one that is, on balance, good enough. In our lives, we will all experience adversity and trauma. Sudden shocks and prolonged periods of unhappiness, some that happen by accident, some as the direct result of neglect or even abuse. Think of your worst and most painful experiences and how they have made you who you are. Sometimes there are things you never knew you needed, real or emotional, that you just don't get. When you needed it most, did you ask for help? Did you get physical, psychological, social, or spiritual support? Perhaps what you needed came from medical treatment and advice. Perhaps through being heard by an important person in your life, or through professional therapies. Perhaps it came in finding people who listened and understood, so that you didn't feel alone. Maybe it came from within, as you drew on your internal resources and creativity to make your own unique mark on the world. Perhaps it was all one of these things. To what extent is the person you are now a product of your vulnerabilities and your resilience? Which is more powerful in your life? The conscious thoughts you use to make decisions, or the unconscious forces that seem to make decisions for you? Do you live with purpose and a clear sense of right and wrong? Do you know social from antisocial behavior and have a solid idea of how your actions might harm yourself or others? Do you believe that the level of justice and fairness in society is non-existent or good enough? Has your education left you capable? Your occupation provided for your needs? And your life left you healthy, adaptable, stable, flexible, and functioning? Do you know where you belong and what you are worth? Or do you feel separate and alienated from the people around you? Have you ever lost a loved one? Are you, at this moment in time, dying? Your experiences and thoughts around death can build up to become beliefs. Your knowledge, your fear and acceptance, perhaps the need to pass something on, will all affect how you choose to live. Each one of us is a product of complex interactions that take place over a lifetime.
Okay, let's stop there. Okay, so I believe we've gotten the message and understand the complex interaction between all the things that happen before we are born up till death, how that can lead to problems. So let's go back to our presentation. I believe we can watch the rest later on. In documents. Can you see my screen?
Yes, we can.
Okay, and that's great. So let's continue. So in terms of the prevalence, so we can see in the survey up to 6 in 1 people in the UK have generalized anxiety disorder, and anxiety tends to co-occur often with depression, for instance. So in a study, up to 2/3 of people who have anxiety also have depression, and similar for people who have depression, they tend to have anxiety as well. So now we do find in lots of studies really that female are more prone to having this anxiety and distress related disorders compared to men, and they tend to have it more, they report more severe symptoms compared to men as well. So why is this so? Can anyone say anything about this? Okay, perhaps we will discuss more later on at the end. What research is showing, first, again, it's about the genetics as well as the environment, really. As you said, we do know that women, the way their brain appears to be wired in a different way. They are more emotional in terms of the way they react to all those stresses. Okay, and
yeah, some answers there. Some say hormonal imbalance.
okay,
To your question. Yeah.
good.
Yeah, those are the
Yes.
main ones. Those are the
Yeah,
main ones.
certainly. So it's about the genetics as well as the environment. So all those things that we've talked about earlier in terms of causes and etiology and risk factors. Particularly, we do know for women, they tend to be more emotional in their reaction. And so when they're presented with those stressful events, they may generally tend to react more to them. So that puts them at risk of developing those stress-related disorders and anxiety. And also, in terms of the environment, they're under a lot of pressure really to sort of fit in and conform to expectations of the society that they do live in compared to men. And also in terms of you find the gender discrimination and of course the even with this a lot of women are still struggling with receiving the same pay. Of course, I know people who are footballers will there's a debate about this that yeah, why should women earn the same if they're both footballers? So so we can see the definitely all this eventually would have an impact on women. So for us Muslims and people who do have women in their around them, that it's important to be aware of this and manage that accordingly. So in terms of prognosis, comorbidities and complications. So anxiety disorders, people who have anxiety disorders, I think we've said it, they tend to they have an increased risk of developing major depression, as well as turning to alcohol and drug abuse. There's increased risk of cardiovascular problems, for instance, hypertension and arrhythmias. People who do have arrhythmias, there's increased risk of having sudden death. So, of course, we've talked about the functional impairments and decreased quality of life. And then there's increased risk of suicide, regardless of whether the person has secondary depression in addition to the anxiety or not. So, and when you now had acute stress or acute stress situations to anxiety, mood, and substance abuse, the risk of suicide even increases further. So, this verse in Surah Al-Tawbah, in this verse in Surah Al-Tawbah, Allah subhanahu wa ta'ala describes a scenario where Prophet Muhammad sallallahu alaihi wasallam was making hijrah with his companion Abu Bakr radiallahu anhu, and the Quraysh were tracking them, wanted to kill them, so they had to hide in the cave. So then Prophet sallallahu alaihi wasallam demonstrated his faith in Allah and trusting in Him, and Allah said He sent down His sakina, His tranquility upon them. So and tranquility, that's the word we're looking at. And this is one of the main goals of treatment in anxiety and stress-related disorder. So, which is why some of the medications we use, like benzodiazepines, they used to be called minor tranquilizers, and antipsychotics used to be called major tranquilizers. So you want that calmness. So we don't use those names anymore in terms of tranquilizers. So the mainstay of treatment, or the first line of treatment for anxiety disorders and stress-related disorders are now SSRIs. So that is selective serotonin reuptake inhibitors. Examples: citalopram, fluoxetine, sertraline. So they are the first line. Of course, the issue with them is that they take a while, about a couple of weeks before you start seeing changes, and up to 6 weeks before you get the full effect of those medications managing anxiety and stress-related problems. Pregabalin and benzodiazepines, people have to be careful because they can be quite addictive. And you don't generally tend to use second generation antipsychotics as first line, except when you've tried the first line and they haven't worked. So on your left-hand side, you see the psychological therapies like CBT, cognitive behavioral therapy, applied relaxation, interpersonal psychotherapy, and gradual desensitization of exposure. So this is often useful in agoraphobia and specific phobias, really. Then there are other interventions that have to be taken into consideration. For instance, stopping to take caffeine-containing drinks. I know in these days, particularly, it's common among students, people taking energy drinks, caffeine, like Red Bull and Monster. So when you're feeling anxious and you're still taking those, so you should know the source of your anxiety. Then mindfulness-based meditation has also been proved to be beneficial. Adequate exercise and sleep is important, as well as there's a lot of evidence for spiritual interventions in managing anxiety and stress-related disorders, even other mental disorders as well. We'll talk about this. So in terms of CBT, one of the things CBT helps us to do in managing problems is helps us to change our thinking and behavior about the problem. So one of the problems in when people have anxiety or other mental health issues is that they experience what's called cognitive distortions, and these tend to entrench those anxieties. So it's a form of abnormal thinking pattern. So, for instance, there's all or nothing thinking. An example will be somebody who failed his exam, maybe professional exam, accounting, or medical exam, and they believe they're a failure, or they're trying to get a particular job and they've not been successful in getting an interview or passing the interview, believe they're a failure, nothing, they shouldn't be alive, and they cannot go on. So yeah, the therapist would help them to identify this negative thinking pattern, and help them to see, oh, failure or progress is not an all or nothing affair. So there's a lot of other things you could be doing and get your satisfaction and fulfillment from. Another example will be catastrophizing. For instance, somebody always thinking about the worst case scenario. They miss the bus and they start thinking, oh, nothing is going to go well that day, and everything is just going to go wrong. And they're always thinking about the worst case scenario. They are going to die. They won't come back. They're going to have an accident and all that. So perhaps we could. Then another one is jumping to conclusion. An example would be maybe a sister who greeted another sister, but the sister didn't respond. Then they may jump to conclusion, saying, "Oh, the sister doesn't like me." So, well, the therapist and nobody likes me. It affects their self-esteem and they feel worthless. So the therapist would help them to sort of identify this, and that they actually jump into conclusion, and they ask them to present evidence. So one of the things the therapist will do is to get them to record their thoughts. And also at times they will ask, present an evidence that supports your claim and evidence against this, against your claim, and will help them to rationalize and get to a point to say, oh, they have been having abnormal thinking patterns and they need to change. So an example here is a man or a young dad, a new dad, who the problem or the stressor is that the baby won't stop crying, and the dad jumps to conclusion, oh, I am a useless dad, and continues to ruminate and worry. Then he feels sad and begins to feel low, poorly motivated, his sleep is disturbed, he feels deflated. Then in terms of behaviors, he begins to avoid the baby. So what CBT does is to help, or the therapist will help to identify that, or establish that the thoughts are actually linked to the situation and also linked to your emotions and physical feelings and then the behaviors. And we'll now try to help you to change this. We've talked about the cognitive restructuring of the reframing of the cognitive distortions in the previous slide. So then the therapists will also help them to do what's called behavior activation or activity scheduling. So how will help, the therapist will tell them to keep a diary of and plan a schedule of how to manage the baby step by step, so that things would improve. So this is roughly in a nutshell what CBT does in helping people to change their thoughts and behavior pattern to resolve the problem. We see an interesting parallel here in Surah Al-Dua. We know what happened to the Prophet Muhammad sallallahu alaihi wasallam there. He didn't receive revelation for a period of time, and he became sad. Then Allah revealed this surah, starting with an oath, then contrasting the bright forenoon with the still night. A lot of the time, people who are anxious or depressed, they feel they have been in this very dark tunnel. So we can see how Allah subhanahu wa ta'ala reassures the Prophet Muhammad sallallahu alaihi wasallam and validated his experiences, then reassured him and gave him promise of a better future and a promise of being fulfilled. So this is essentially why people go to therapy, really. So they want fulfillment. Then we see from verses 6 to 8 of that surah, Allah subhanahu wa ta'ala presents evidence of accomplishments from the past. So this happened to you. ألم يجدك يتيما فهوى ووجدك ضالا فهدى ووجدك عاقلا فأغنى. So I found you an orphan and I protected you. I found you in want, I enriched you. I found you in want of guidance, I guided you. So you can see there's evidence that Allah has supported him all through his life. So this should help him to change reframe his focus and stop that negative thinking. And then Allah gave him things to do in terms of ensuring justice, charity, and compassion. And finally, Allah ended the verse, فَبِنِعْمَةِ رَبِّكَ فَحَدِّثْ. So there's evidence, growing evidence that narrative therapy, that is people writing their story of their mental health journey, helps to improve recovery, improves recovery outcomes. So it's widely done in rehabilitation now, but particularly for very severe mental health disorders. So you can see the hadith at the bottom of the page from Abu Dawud, Jabir narrated that Prophet ﷺ said, whoever overcomes some test or calamity and mentions it to others, then he is indeed thankful. And whoever conceals it, then indeed was ungrateful. We can see a lot of verses that involve psychological techniques or refers to psychological techniques in the Quran. So one cannot but help but notice the expertise in the Quran regarding this. So, for instance, in this passage of Surah Al-Isra, Allah subhanahu wa ta'ala mentions that Quran is sent down the Quran as a healing and mercy, but people who are wrongdoers will always be in loss. They will not be able to benefit from this. Then I will just want us to point out Allah describes an individual presented with a stressful situation. So when evil touches him, so he responds with total despair. So, but everyone acts in his own style. So that's shakilati. So the style is the character of a person determines what they do in response to a stressor. So that's what Allah is saying to us there. And then the next verse says the soul, it is only Allah that commands the soul. And the tafsir of this ayah, the scholar said, when Allah asked the angels to breathe the soul into the body, and once it touches the body, it becomes the nafs. Because the soul is pure, but once it touches the body, it becomes the nafs. And you can have nafsul mutma'ina, those who are striving to purify their souls, or nafsul amara bisay, those who continue to engage in evil acts. So essentially, the type of soul you develop affects your character, or your style, and the way you would respond to those stressors. And of course, Allah mentions so many times in the Quran, as well as Surah Al-Baqarah. So those who follow his guidance, they will have no fear and they will not grieve. And again, in Surah Al-Ma'arij, Allah talks about people that generally we have designed, we are created this way to be impatient. So it is genetic. It's part of our makeup for people to respond to stressors with distress and despair, but except those who pray. So, and those who are constant in their prayer. So you need that connection with Allah to be able to manage stressors in the way that is expected by Allah. So, and again, I would like to point out so many things that we can do to manage stress. So one thing is called, one of the techniques is grounding techniques. So these are things we can do that divert our attention and focus away from the worry to the here and now. For instance, there's the 5-4-3-2-1 grounding technique. So if you're in worry and stressed, or you know somebody who's worried and stressed, you can tell them to list 5 things they can see, 4 things. So it's linked with breathing techniques. So you start with breathing, taking 3 deep, slow breaths in, then slow breaths out. Then I'll tell the client to list 5 things they see, 4 things they feel, 3 things they can hear, then 2 things they can smell, and 1 thing they would like to taste. So if we link this and compare this with wudu, the ablution that we make before we pray. So for instance, we open the tap, we can see the water here running, we can hear it running as well. Then we wash our hands, we can feel the warmth and the coolness depending on the temperature of the water. Then we rinse our mouth, we can taste the water, and we sniff it and wash our nostrils, we can smell it. Then we splash the water on our face and washing our hands. So you can see how this can lead to grounding and lead to removal of stress, particularly if we do this regularly, at least 5 times a day. We should be able to appreciate what Allah has done for us in managing stress there. So be exposed to trauma, particularly from images, traumatic images and news. And as Muslims, it's not just now. It's been really constant. One region or the other, we find people experiencing trauma. It's been going on for several years and decades now. So I think it's really important for us to be aware of what's known as trauma-informed approach, really, so that we can help ourselves and manage ourselves better. So trauma-informed care or approach involves being able to recognize trauma and its impact in the clients or people, and taking steps or responding in
Dr.
ways.
Abdulaziz, 5 minutes, please. 5 minutes, please.
Okay. Responding, Jazakallah khair. So responding in ways that will not cause further harm to the individual. Or it's really important because people who have been traumatized, they lack that sense of safety and sense of control. And if they experience this again, then they won't engage because they want to protect themselves. And the tendency is that they would, if they continue to experience this, it leads to re-traumatizing them. So we want to avoid this. We want to establish a caring, compassionate, trusting relationship with them, a collaborative approach. Then interventions have to be targeted based on the recovery stage that people are at in terms of those who have suffered trauma. The first stage will be stabilization, then the remembrance, where they process memories of the trauma, then mourning, where they give a meaning, beneficial meaning to the trauma, and then reconnecting themselves, looking beyond the trauma, reconnecting themselves to the society, and doing things they want to do so that it can be fulfilled in life. So I want us to compare and contrast that with what Allah subhanahu wa ta'ala did, described in Surah Al Imran regarding the Battle of Uhud. So I think perhaps you can look this up later on in our own private time, but we can see that a lot of this trauma-informed approach has been employed. I'm sure a lot of us know about what happened at Uhud. So a lot of the questions that even people are not able to answer now, in terms of why the trauma, why is this happening to me? Why is this happening to us now? What is the purpose? So Allah subhanahu wa ta'ala answered that. And how do we move on? Do we look beyond the trauma in terms of compassion, forgiveness, and reconciliation? And the qualities we need to develop to move on: trust, courage, and determination. So again, more Allah subhanahu wa ta'ala telling us how to reframe loss. So rather than thinking negatively about stressors, we think about it as a test. If you are patient, then you get rewarded for it. And to be prepared for the stress, really, and anticipate, oh, this is what we are here. We are going to face this one way or the other. But my reward depends on how well I'm able to deal with this in the way expected. So it's really important to get help for ourselves and for other people. So these are links. Mine is a very important charity. lots of support, lots of materials online as well. I think this is a story of a woman who had a stressor. She was feeling lonely. She was an elderly woman, but then she got other people together, and they developed a peer support group for women, and eventually they won an award. So it's really about what do we do with the stressor that we are faced with? Can we help ourselves and help other people? So this is a summary of all that we've talked about today, about stress, anxiety, and how to cope with it. So thank you for listening. So we can open the floor for discussion now.
Jazakumullah khairan, Dr. Blaziz, for that peaceful presentation. I'm sure some of us will be, shaking our heads. We can relate with a lot of those things that we've all gone through. It's giving us key ways to actually manage, to prevent, and to ameliorate the damage for those who are actually going through, severe stresses at the moment. I think one key point for me is the relationship between Al-Quran and the current modern evidence-based management for a lot of these things. I think it's key here that we become more conscious of our religion, learn more about our religion, and inshallah, a lot of those solutions will be there. Seek help promptly. Don't be shy. Mental health is real. Stress is real, especially in the modern days. Seek help promptly before things escalate to a stage where it becomes really difficult to find solutions to it. But inshallah, there's always solution somewhere. May Allah subhanahu wa ta'ala keep us safe, keep us healthy. I would like to allow some comments and questions. We only have about 15 minutes to go. So if you do have any questions or comments, I want you to make it very brief, within 30 seconds or so. Do raise your hands. If you prefer to type in the chat area, you can use both the Zoom chat area or the YouTube chat area, inshallah. I would like to allow some comments now. Now there's somebody saying, let's just check in, see what people are saying. Yeah, Jazakumullah khairan. So yeah, that's that. Anyone raising their hands? Yes. Yes, Brother Ismail, or is that Prof Ismail? Do you want to unmute yourself and ask your question, make a comment, please?
It's a family. So I'm with Professor Ismail.
Okay, go ahead. Go ahead.
It's Nurat. Now,
no.
Thank you so much, Jazakumullah khairan, for organizing this topic. Is very, very valid and is important at this moment. And I would like to thank Dr. Abdulaziz as well for his comprehensive knowledge that he has provided and given us today. I just want to say something about the area of the CBT approach. That many women, because as a psychotherapist, I work with a lot of women, young people who have this anxiety and stress problem. And what I notice in our community is a lot is going behind closed doors. But many people attribute, if you have mental health problem with faith, the stigma that maybe your faith is reduced or you don't have any, your iman is lacking or something like that. And again, people don't want to go for therapeutic healing because they believe if I'm reading my Quran, that should be all right. But then, just quickly to raise this, that it doesn't matter, because sometimes when things happen in the subconscious life, when you have, for example, ACE, or you have trauma in your life, and that has come back into your marital situation or as an individual in your personality act or behavior, then that is when you need to seek the rehabilitation. Like you need to seek somebody to help you, like a professional support to help you fine-tune and guide you towards how you can help yourself. It doesn't matter if you have Iman. It doesn't matter if you have less Iman. And this happens majorly around women. And men as well, because they've been told men do not cry. So a lot of them hide things until when it is like at the peak. That's when people cry out that, please, I need help. So I think, Doctor, maybe we can reiterate this as well. May Allah subhanahu wa ta'ala continue to increase in knowledge. Jazakumullah khairan. Thank you.
Jazakallah khairan for that important addition. Very, very important to seek help. Nobody's above, seeking help. Especially women, we are a bit more prone in some instances, and we are one of those that would like to keep bottle things up and say, we need to man up. It's okay to cry, and sometimes that could be therapeutic as well. So I do see Nigerians, coming to my clinic and, crying in front of me. We're talking about 40, 50s, saying I'm feeling low. I said, it's okay. I'll allow them, even though it's more than my specified time, allowing them to cry helps, and it's very therapeutic as well. So don't feel shy. You can go into a room and then cry your head off if you need to. Seek help. You can cry in front of the professionals. We are professionals. It helps sometimes. So don't feel you can't speak up, or it's going to make you less of a man or a woman if you speak up or if you seek help. I don't know if Dr. Abdulaziz would like to say something about those points Umu mentioned.
Yeah, Jazakumullah khairan for the contribution, Umu, and Dr. Abdul Majid as well. Those are very valid points, really. We cannot reiterate enough the importance of seeking help when we do need to. So it's so important that, because if we leave things to go on for too long, it gets worse. It becomes more difficult to get good outcomes. So that's the way mental health disorders are. The more those, that was I showed you the picture of the brain and the nerves for a reason. So if it's like damage mental health or stress, they do damage those nerves. Although they can regenerate, they can improve, but the longer we allow things to fester, the more difficult for us to get good outcomes in terms of going back to the original state. So it's really important to seek for professional help. Of course, we all have different degrees of stress and anxiety, but one of the reasons why the organizers have made us to come together to discuss this is that to be able to identify, oh, this is getting out of hand, we need to seek help, professional help. That's why we're here. So it's really important. So Jazakumullah khairan, Umu and Brother Abdul Majid for the contributions.
And that was Sister Nuwat Adilopo, our ex-Amira. Jazakumullah khairan. And we have Sister Fatima. Do you want to unmute yourself and ask your question, please?
Yes, so mine is not a question. Assalamu alaikum wa rahmatullahi wa barakatuh. It's just a quick contribution. Alhamdulillah, we were having this conversation at another forum this morning. And my contribution then and now is also for us to pay attention to how we are contributing to the stability or otherwise of our mental health. And I want to talk in terms of diet and lifestyle, on our nutrition and our lifestyle. Very simple things. Dehydration to the degree of as little as 2% has been scientifically proven to elicit or evoke stress response in the body. And Allah has told us that we were created mainly from water. That's one. Two, additives to food, and particularly condiments that we often and most we are very used to using. In particular, MSG. So that would have in our stock cubes, our Maggi, our Knorr. This is known to be a neurotoxin. What else do I want to mention? Blue light from our devices, whether our computer or our phones, even if it's for us, even if it's when we're using these gadgets in a beneficial manner, we should not also undermine ourselves. And our sleep hygiene is another thing that we need to focus on. So I just thought, to bring all of this to the fore, and movement as well, which Doctor had alluded to in the slides. But for us to bring this to the fore and bi'idhnillah, encourage ourselves and talk about it more in the community so that we can practically incorporate this. I'm very happy that he mentioned wudu, which is one of the things I mentioned as well earlier this morning. But these are things that we need to bring to the fore so that all of us as Muslims will begin to adopt or better understand what we've been gifted and what we do routinely without thinking, so that when we have this, trouble moments, we also feel quickly reassured that we have the tools. When I know I'm stressed, which would happen because life is lifing, as they say, I know I'll go and make my wudu because I know it's got a spiritual and physiological effect on me. And also it helps even the younger generation to understand, because this day and age is more evidence-based than any other time. I don't want to be telling a younger person, or as a younger person, I don't want you to just tell me, go do dhikr, go make wudu. Why? So for all of us entirely, young, old, across board, we need to understand our why. And that's why we need to, better understand our religion and what is in there. And Jazakallah khairan, my brother, for the way you have presented this and brought, juxtaposed your presentation clinically with the science, the science in the Quran and the Hadith. So may Allah reward us most abundantly and benefit us by this.
Jazakallah khairan, sister, for that important addition. There is a question on here, Dr. Abdulaziz, that at what point do we know, or can we know that we need some professional support?
Yeah, thank you for that question. Like I said, everybody feels anxiety or stress at one point or the other, but it becomes a mental disorder. It becomes a disorder, anxiety or stress-related disorder, when it affects our functioning. Does it have an impact, negative impact on our personal life? Are we able to do the things we want to do, or we are not? So if it stops us from doing the things we want to do, it affects our relationship, it affects the way we relate to our family, our children, it affects our job, affects education, occupation, or even social interaction. So then it's important to seek help. I don't know if I've answered your question.
I think it's been answered. Jazakallah khairan. Any further questions or comments? We still have about a couple of minutes before we end today, inshallah. Just checking. Yeah, no hands are raised. Jazakumullah khairan, Dr. Abdulaziz, for that beautiful presentation. I'm sure, inshallah, we'll still need you to come back in the future. And then, inshallah, we hope that we will bring some other important topic that has been raised here as well. There are other mental health aspects that we would like to, that are very common that we would like to deal with, inshallah. So watch this page, inshallah. Something like insomnia will be something that we'll talk about, and how do we manage stress of not sleeping well? What is the so-called sleeper hygiene? And what are the dangers of screen time? So these are some of those topics that I think are important that we hope, inshallah, in the nearest future, we'll bring them to the fore as well for us to benefit ourselves. I don't know if you have any last or final words before we close to this session, Dr. Abdulaziz.
Jazakumullah khairan to you and to the organizers and to the audience. May Almighty Allah continue to be with us all and our families, and continue to make us be walk in His path. It's a very stressful time for us and for our families, based on all that's happening all around. But we just need to keep going and support one another. Almighty Allah continue to bless us whilst doing this. Jazakallah khairan.
Amin wa yakum. Thank you very much, Dr. Abdulaziz. So inshallah, this is going to be our final session before the summer camp. In a couple of weeks' time, in a fortnight, it's going to be our summer camp. So there won't be a fortnightly Usrah. Will join us back after the camp. For those of us who are fully registered, the registration I think is closed now, except for those who want to be coming and going and sort out their own accommodation. Otherwise, it's closed. So inshallah, we're looking forward to see everyone at the camp. And yeah, so I think we'll leave it there. We'll bring to us again so many other important topics that has to do with our religion, our akhirah, our hereafter, and with our daily livings on how we can improve ourselves as a human being, how we can interact with our environment in a better way. So inshallah, make dua for us and make dua that everything we lay our hands on goes well. Ask Allah subhanahu wa ta'ala to accept this from you and I as act of worship. Without much, I think we'll end it here, inshallah. So we say wal asri together. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم والعصر إن الإنسان لفي خسر إلا الذين آمنوا وعملوا الصالحات وتواصوا بالحق وتواصوا بالصبر سبحانك اللهم بحمدك أشهد أن لا إله إلا أنت أستغفرك وأتوب إليك سبحان ربك رب العزة عما يصفون سلام على المرسلين والحمد لله رب العالمين. It's Dr. Abdul Majid here. We'll see you in a month's time. Wassalamu alaikum wa rahmatullahi wa barakatuh.